Idaho Health and Welfare Department is addressing lawmakers this session in attempts to add a housing facility for the developmentally disabled in the state of Idaho. Right now, no such secure facility exists.
You might remember last night we introduced you to a Canyon County woman who has spent the last 10 years just bouncing between state-operated facilities. But because of this void, she continues to wind up in the legal system despite the fact that she's incompetent to stand trial. Tonight, 6 on Your Side's Karen Lair has part 2 of our exclusive On Your Side investigation.
26-year-old Caitlin Hodges has spent the last decade bouncing between state-operated mental health facilities and hospitals, doctors determining she has the mental capacity of an 8-year-old.
She can tie her shoes, she can take a shower, she has a little trouble rinsing all the shampoo out of her hair, like those kind of things. Just picture an 8-year-old, what you would need to help them with.
Her physical strength, however, is that of an adult, damaging property and winding up behind bars on multiple occasions. And while in custody, the problems don't stop.
She's strong, right? And so that adds another layer here. And when she gets upset, she acts out. I've had numerous officers injured by Katie.
Several deputies even out on leave because of injuries inflicted by Katie, and Health and Welfare understands the frustrations.
They don't really have the tactics and ability to really work well with those folks.
The incidents result in more charges, even though Katie's been found incompetent to stand trial.
They are just coming up empty-handed. They don't know what to do. So each time she gets in trouble, they have her arrested and she goes to jail. And the jail holds her there, which is not an appropriate placement.
But even while in custody of the state, health and welfare employees often face physical threats from patients because of inadequate security features, leading to a great deal of workers' comp claims and staff out for days with injuries because right now they can't set alarms or even lock doors.
It's just not safe. And so what we end up doing is having our staff basically act as the security. And so we have tremendous issues with that because staff get injured.
According to Gilliland, 40% of their staff makes workers' comp claims each year, and 88% of those are based off intentional client injuries. But the state doesn't have a permanent solution as for where to house people like Katie, those dangerously mentally ill who pose a threat to themselves and others.
We know that they're coming, that these people are out there, the issues are out there, and they're going to be coming before the courts. They're going to be coming before the state. She's not going to be the only one.
It's a very challenging situation for the state to know what to do with those folks because we don't have a facility that's appropriate to care for them.
Last year alone, the state faced $45,000 worth of property damage because of clients housed in state care, in part because current law prohibits them from taking certain measures to secure portions of the facility.
Under our licensure there, we can't lock doors, we can't harden the facility, we can't prevent people from having their private property that might be used as weapons, those sorts of issues. And so we found that we really need a more kind of stronger facility for those folks.
The state absolutely has to wrap its head around this issue and obligate the funding to do whatever it takes to take care of these people in our society who need to be taken care of.
This year, though, the Health and Welfare Department is introducing legislation to establish, operate, and maintain a secure treatment facility for persons with an intellectual or developmental disability who pose a substantial threat to the safety of others.
Over the past few years, we've been challenged with a few people out there that are quite dangerous.
But
it will likely take a few years for the facility to be put together.
So for now, they're working on a short-term solution, turning one wing at the State Hospital South into a high-risk unit, but not quite a secure facility.
We need to be able to have locks for the doors. We need to be able to have alarms in case people get out. We also probably need to get some fencing around whatever the unit will be. So hopefully this year it will go through.
The fact of it is, that needs to be done sooner than later.
Karen Lair, 6 on Your Side.